It gives me great pleasure to introduce our next speaker, Dean Lloyd Minor. As I said in the beginning, Lloyd has been a singular contributor to the vision of precision health for Stanford, for the nation, for the world. Lloyd is the Carl and Elizabeth Newman Dean at Stanford University School of Medicine. Under his leadership, he's established a strategic vision to lead biomedical revolution in precision health, a fundamental shift to more proactive and personalized health care that empowers people to lead healthy lives. Lloyd has been very welcoming to me here at Stanford, and it's been really great to have his support in starting a new chapter in my career. Prior to coming to Stanford, Lloyd was the provost at Johns Hopkins University, so he understands what it's like bringing people together and moving things forward. Lloyd is also an elected member of the National Academy of Medicine. Lloyd, thank you for joining us this morning.
Well, thank you very much, Joe. And I want to thank Joe and Dr. Gary Gold for organizing this third Gambier Symposium on Precision Health and Integrated Diagnostics. It's wonderful to see so many people here, and I know more will be joining through the video recording and live stream. I know that Sam would be proud of everything that all of you are doing and everything that all of your colleagues are doing. Sam was such a visionary leader and such an inspirational force in biomedicine, certainly here at Stanford and around the world. Indeed, Sam had the vision that I know all of you here have heard and that you embrace, that medical care, that health care, that health should be more predictive and proactive rather than after the fact and reactive. You know, in our country, we have an amazing sick care system. There's no better place for a complex organ transplant. There's no better place in the world than here in our country for the care of advanced cardiac disease or advanced cancer. And that's something we should all celebrate and be proud of, including the fundamental contributions that so many colleagues here at Stanford have made over the years to providing the very best care and new treatment modalities and options for people with severe, complex, acute diseases. But wouldn't it be nice, wouldn't it be desirable if rather than, or in addition to, having this after-the-fact sick care, we did a better job of keeping us all healthy and predicting and preventing, when it's not possible to completely prevent disease, to detect it earlier and therefore treat it more effectively. That was Sam's vision, and he spoke passionately about that vision. Sam talked about the fact that every time one of us got on an airplane, the engines of that airplane were constantly sending information back to monitoring centers down on Earth to look at the performance of the engine in real time. And that information was analyzed in real time in order to determine when maintenance, preventative maintenance on the engine was needed. Now, why don't we have something analogous like that for human health? Or why is it that, you know, we periodically get lab exams and even the value of a routine physical exam is somewhat questioned if you look at various aspects of the evidence-based approaches to analyze its impact. But within our grasp are the opportunities to do so much more in diagnostics. And Sam was a pioneer in that. A pioneer in ways that we can all here in the area, in Silicon Valley, in the country, can relate to in terms of the vision and the out-of-the-box thinking. You know, having the concept of a smart toilet, having the concept of a smart mirror that looked for signs every morning. What do we do every morning when we brush our teeth or get up? We're looking at a mirror, usually the same mirror in our house. We know that a lot of the aspects of that vision remain to be realized, But let's use this symposium and the work that comes out of it to redouble our efforts on thinking about how we can bring that vision of having more predictive and preventive approaches to health and healthcare, having that vision become a reality in everyday life. And we're already seeing evidence of the impact of the vision and tangible results. Project Baseline, which Sam was very influential in starting, is gathering data on thousands of participants here in the Bay Area and elsewhere around the country, tracking their health longitudinally over time and analyzing a variety of different biological measurements and diagnostic studies in order to monitor their health and also in order to, when they do become sick, be able to look back and discern a signal that might have been a telltale sign of the illness they were about to develop. It's going to take many years to know the results, but just look at what we learned from a study started many decades ago, the Framingham study, and what it is taught, and which compared to Project Baseline is fairly simplistic in what's being measured. But look at what we've learned because of the value of that longitudinal data from the Framingham study, gathered and then analyzed and then used to drive advances in health and healthcare. Baseline is going to take that to a whole new level. Also, through the innovative work that's being done in the FIND Center and the leadership of Dr. Gary Gold and Dr. Joe DeSimone in the FIND Center, there are new diagnostic modalities that are being envisioned and tested every day. And we're seeing the impact of that, already seeing the impact of that. Looking for biomarkers to detect early stages of cancer. When these studies and tests first became available, a lot of people questioned, well, would you ever be able to detect a meaningful signal amidst all of the noise? And yet we're seeing that the answer to that question is yes. More work remains to be done, but the advantage of approaches such as biomarker approaches for detecting early signs of disease, the advantage is that the longer you do them, the more data you get, the better you get at detecting the signal from the noise. So it's only going to improve over time. Add to that the power of AI, including something that I'm only beginning to grasp, I think all of us are only beginning to grasp, that is the transformational power of large language models and generative AI. And we really do see the pieces of the vision of predictive, proactive healthcare starting to come into focus in actionable ways. But it takes the sustained commitment of all of you and your colleagues to doing the research, to getting that research into the clinic, and then to analyzing the results of that research in the clinic in order to improve the protocols, and always, always maintaining a focus in making sure that those clinical studies and the enrollment in the clinical studies and the impact of the clinical studies have the maximum impact on breaking down the disparities and the inequities that exist in health and healthcare in our country. All of this is possible because of the great work you and your colleagues are doing in FIND and so many other people around the world. So today, let's learn a lot, let's share the energy we all have for this field, and let's remember a true pioneer and innovative spirit and dear friend, Sam Gambier, who helped us get started along this path and whose memory and legacy we honor and cherish through the work we're doing. Thank you very much.